So we're part of a group of advanced practice nurses in gynecological oncology from across Canada: Alberta, Montreal, Kingston, London, Ottawa, Hamilton, Toronto. And we formed a community of practice, or COP, and discovered an innovative, powerful, and effective platform to develop and validate best practice, move projects, and implement research initiatives. So what is a community of practice? Communities of practice are groups of people who share a concern, a set of problems, or a passion about a topic, and who deepen their knowledge and expertise in the area by interacting on an ongoing basis. So these people don't necessarily work together every day, but they meet because they find value in their interactions. As a group of specialized oncology nurses, we were easily poised to coalesce into a COP. We already had an existing social network. We met annually at the Society of Gynecologic Oncology of Canada meetings. Our GOC nursing group, we also communicated via teleconference 4 times a year. And we were a loose network of about 8 to 10 nurses from across Canada with some long-term core members. So communities of practice, it's a natural part of the organizational life. And potential community development begins with this existing social network. So this is a loose network. So like a seed, a potential community already comprises some basic elements of a developed community and has the full potential of becoming one. So the seed needs a catalyst, however, to start evolving. Any important topic in an organization usually attracts an informal group of interested people who begin networking. The potential community is energized by a passion for the same topics, have data, tools, and approaches that they can contribute, and have valuable insights that they can learn from each other. So a community of practice emerges. For us, the initial catalyst was a new treatment that impacted our clinical practice. And you may remember in 2006 when intraperitoneal chemotherapy became standard of care for women with ovarian cancer. More than 20 years of investigations, 3 major North American phase 3 trials showed improved survival. So our challenge as advanced practice nurses across Canada in our individual centers was how to translate this knowledge into practice. Without going into details, we all know this is complicated stuff, infusing chemotherapy into the peritoneum. And what we realized that we had this loose network of nurses who knew each other, but now we had a focus. And by learning with and from each other, we quickly appreciated that our collective knowledge of our group was greater than the sum of each of our individual knowledge. And by sharing ideas and expertise through collaboration, partnership, and networking, mostly by email and teleconferencing, we were able to quickly develop the necessary nursing skills, and we're ready to offer this treatment to our patients. We had successful outcomes in the key domains of knowledge sharing and knowledge creation. The innovation was quickly implemented across Canada, and we were able to effectively and efficiently develop knowledge translation tools, so policy and procedure, education materials, documentations, and assessment tools. We became informally bound by the value in learning together, which was very instrumental for our work, but it was more than this. We've sort of really developed a common sense of identity and belonging. Feeling that you can speak to like-minded people and you have a real sense of belonging. So we discovered that the COP methodology is effective in identifying the practice problem, articulating the vision, defining the gaps, and developing solutions to implement better practices.
So now that Nancy's told you a little bit about how our group really got formed, we wanted to just talk a little bit more about what we see as nurses as being the benefits of being a member of GOC and then being a member of the Nursing Professional Practice Committee as well. So in being a GOC member, you're part of an interdisciplinary professional society that's focusing on gynecology oncology. So for those of us that most of our practice is in that area, it was the chance to really work with people also focusing on that specialty. Many of us are members of CANO as well, and at that time there wasn't any special interest group, so although we had connections with other oncology nurses, this was the place where we really made the connections with the other people working in the same specialty. We have access to resources like the GOC website of GOC and the members-only section of the website. And we have some resources that we've worked on that I'll talk about in a few minutes that are available if you're a GOC member to you as well on those websites. We have the annual Continuing Professional Development Meeting, and now for the third year, our Nursing Symposium. There's also an annual general meeting conference every year in June. And through our committee, again, we have that link to the other nurses in gyne-oncology. We've actually increased the frequency of our teleconferences, so I would say we do probably about 8 a year in total. We have access through GOC to a toll-free conference call line for us to call in and do those conferences and to have the connection with each other. So one important part for us in getting the group established was to have organizational support. So support both from the professional association, so in this case, the support of GOC, and then also from our individual hospitals and cancer centers. And I think that we're able to go back to our cancer centers and demonstrate the benefit, not only to us as individuals, but the things that we're able to bring back to our centers as a result of our collaboration in this group. So Nancy briefly mentioned where the group members came from. So these are the members that are kind of actively participating in the group right now. And the idea when the group was formed was to try and have like one representative from each of the cancer centers who could participate in the calls and then kind of be the point person back to other nurses working in GYN oncology in their centers. So there's Nancy at the Jewish General Hospital in Montreal, Jan Giroux at Kingston General Hospital, Linda Jurincic at Sunnybrook, myself at McGill University Health Center, Heidi at Jaravinsky Cancer Center, and Carrie at the London Health Sciences Center. Until very recently, we had Alicia Andrews from Edmonton, Alberta, who was a nurse practitioner in oncology. She's recently changed positions and is not in GYN oncology, but we're happy to have more people join our group. We're always looking for people from the areas where we don't have those connections to try and increase our size and make sure that we're really reaching the nurses working in GYN oncology across Canada. So in terms of our activities, we do have monthly teleconferences, not usually in the summer, but yeah, roughly probably 8 to 10 times per year. We work on planning the nursing symposium, so we use feedback from the evaluations of a previous year to help decide on the content, and also a little bit about what's happening in the GYN oncology world. So this year it happened that our evaluations from last year, several people had indicated that they wanted more information on the side effect management of PARPs because they were starting to see more patients who had gone through the trials. And then we knew with olaparib getting the approval that we were all going to see more of it soon. So it was a very fitting topic for us this year to focus on the side effect management for PARPs. We have a nursing representative on the board of directors of GOC, so it's usually one of the two co-chairs of the committee. We have a representative on the CPD planning committee, on the membership committee, and on the CG2 committee, which is a group where GOC and Ovarian Cancer Canada meet at least twice a year, I think. Twice a year, where they talk about the initiatives that they may work on together in order to advance the ovarian cancer agenda in Canada. With the BRCA strategy that is now part of GOC, we've got a symposium presentation on it this year. So in addition to Val's presentation about the side effect management, Heidi's going to talk about the nursing role in BRCA testing. We're working on creating some learning tools, and we've put in conference abstracts to present at the Cano conference in October, and also the Canadian Association of Perinatal and Women's Health Nurses. That conference is also in October, and we thought that that's an opportunity where we can reach the nurses that are not working in oncology, but who will be taking care of patients who may be having preventive surgery for BRCA mutations, or maybe be debating whether or not they actually want to have the testing done. So we're trying to get that information across to all the nurses who might be coming into contact with those patients. Some of the projects that we've worked on developing slide decks that we combine basically information that we all had from our various centers, and instead of us each working on updating, let's say, orientation materials for nurses new to GYN oncology, we've developed slide decks collaboratively. We've made sure that they're evidence-based and they're available to all of us to use in whole or any parts, and available to all of the GOC members. So we've developed slide decks on recurrent ovarian cancer, symptom assessment and management, an overview of ovarian cancer, of uterine cancers. Cervical cancer should be completed hopefully in the next few weeks. And then our next one that we're working on is the vulvar cancer overview in progress. And so those ones that are an overview are all kind of designed for healthcare professionals new to gynecology who, it starts from the diagnosis and testing to all the different treatment options and a little bit about follow-up. So it's been very useful, I can say for me, at the time we needed to update our materials in our center for orientation, and it was much easier to combine and have the input of people. I think it really developed into a good presentation, and we all kind of added something different. So that was a really great and useful project to work on. Some of the other things that we did, Nancy, when she talked about community of practice, she didn't mention that she and Lynn Jolliker, one of our members who has moved on to a different practice area now, went to Thailand to present at the International Gynecologic Cancer Society conference in 2008 about our nursing community of practice, and it was very well received. And we've done presentations at IGCS again in 2010, and in 2012 when IGCS was in Vancouver, our group kind of led the planning committee for the nursing symposium at IGCS. So we've been active in a lot of things. I think we accomplish a lot, but we also, Nancy's slide about socialization, I think is an important one because we've formed friendships. It's great to have the resource of other nurses working in GYN oncology where you can just kind of fire off an email when you have a question saying, has anyone had a patient situation like this? Does anyone know of resources for this? So it's a really important link, and I think a very important professional connection for all of us. So our final slide, it's kind of a busy slide, just shows you kind of for community of practice, what are the key domains? Is this a pointer or it goes back? Okay, I don't think, this is a pointer. So it shows like the key domains, so for example, knowledge sharing, and just give examples of what kinds of things are we sharing, the role of what's being shared, so how is it helpful, and then what are the expected outcomes. So it just kind of summarizes globally what are some of the benefits and the outcomes that you can expect of the community of practice. So we've purposely put time in our agenda today for the coffee break network and socializing because we thought it's a good opportunity for us to have the chance to talk with each other, because sometimes at the CPD meeting, we don't know who are the nurses in the audience, and it wasn't so easy always to make those connections. So I don't know, we may have a few more people, there's a few more people that have registered but aren't yet here, so we may have some latecomers coming in, but I think, take the opportunity at the coffee break to talk to one another. If anybody has interest in joining the group, please talk to any of us who are in the group. We really do welcome new members, and we're really, happy to get representatives from the centers where we don't have anyone.